Hi, I'm Dr. David Hill, and today we're going to talk about how to diagnose gastroesophageal reflux disease, GERD, in babies. Now, gastroesophageal reflux itself simply describes stomach contents coming up into the esophagus. Sometimes they come all the way out the mouth. That's called spitting up, and that is a very, very common issue, almost universal with newborns and young babies. So, when do we call it a disease? Gastroesophageal reflux disease suggests that this reflux, which is normal, is causing some sort of problem for the baby, which is not normal. Now, these problems can range from chronic cough or wheeze to chronic congestion to pain so severe with eating or feeding that the baby doesn't feed very well and doesn't gain weight very well. When any of these things are happening, we feel the need to treat. But how do you know when the problem is present? Sometimes it's really easy. The baby is spitting up tremendously. They cry after every feed. It's a no-brainer that you know what you're dealing with. But sometimes it's a lot more subtle than that because the reflux may not come all the way out. It may just come down to here and then spill over into the airway or up the back of the nose, but not cause obvious spitting up. In those cases, there are radiologic studies we can do. We can get the baby to swallow a little bit of barium in formula and take pictures as it goes down and then as it comes back up to see how bad the reflux is. In really severe or complicated cases, we can even do a study that may require hospitalization or may be able to be done on an outpatient basis where we put a probe through the nose and down the esophagus. There are a couple of different types of probes. It may measure acid, it may measure electrical impedance, or it may measure pressure. But the different probes can be used to diagnose acid reflux in very challenging diagnostic cases, often when surgery is being considered as the ultimate solution. So, talking about how to diagnose acid reflux in your infant, I'm Dr. David Hill.